So Rob, there's two other trends happening in HEOR and in healthcare at large right now that relate very closely to real world evidence. The first is that what we're seeing is a convergence of HTA timelines with regulatory timelines. The old way of doing things would be that the regulatory decision would be made first, and it would be based mostly on clinical effectiveness and also safety. But the HTA authorities need different data. They need more data. They need more data about the value of the treatment, such as its cost, its resource use implications, patient-reported outcomes, quality of life, cost effectiveness. And so typically in the past what's happened is there's been a time lag between the regulatory decision and when the HTA had sufficient evidence that was ready to make their call. But now what we're seeing, and to some extent, clearly this is happening in Europe because of the access lags that are happening mostly in Southern Europe, but also Eastern Europe compared to the rest of Europe. So that's clearly one of the regions where there's greater coordination between the regulator and HTA. But also, and being Canadian, I'm sure you're aware of this, Rob, there's a Target Zero initiative now in Canada, where the goal is to actually have the health technology assessment decision ready the same day that the regulatory decision is made. This is a huge sea change, and there's no way that this could be possible without real-world evidence. The second trend that we're seeing pertains to an increase in federated data sets. And these are things like Darwin EU in Europe, and we also have one in the United States called Sentinel. We have another one called PCORnet. And what these are basically like marketplaces where researchers can access large real-world data sets. Why this is significant is because data are becoming way more accessible to all sorts of stakeholders in healthcare. And sure, there are appropriate protections in making sure that there's IRB approval and access of these data is given to appropriately qualified individuals. But effectively what we're entertaining right now is more of a democratization of data. In the past, a lot of these analyses were really driven by the innovator company. Now what we're seeing is there's all sorts of stakeholders that want in on this game, such as academics, such as consultants, that can effectively use these marketplaces for data and do their own evaluations. Look no further than drug price negotiation here in the United States, which I know Mitch will be talking about, where there was a public call for evidence on the drugs to be evaluated. This is significant. It's a sea change in how and who is developing data.
I think those are both really, really compelling examples, Laura, and I especially like your framing of this as a democratization of data, because ultimately the data and the availability of that data is really going to lead to more open and transparent decisions, which is a key component of what we want to see in terms of transforming healthcare. So thank you for that.